Hello? Just testing to see if anyone can hear me. We're going to be starting in a couple minutes. I see one person has joined me so far. Thanks. I see one person sees me. I guess I'll wait till some more people uh, log on. It's 4 o'clock. I'm going to wait for a few more people to join us before I get started. Let's see. Let's see. Okay. Okay, it is a few minutes after 4 o'clock, so I'm going to go ahead and get started. Um, Thank you for joining me today, and those of you who aren't able to see me live, hopefully will be able to watch the recorded version of this. My name is Cheryl Villaret, and I'm a physical therapist, and I am uh, presenting here today from our Northeast Liberty location off of 410 near Harry Wurzbach, and I am sitting in my treatment room. I wanted to introduce myself a little bit and tell you more about me and my experiences and why I got into treating lymphedema. Um, I've been a physical therapist for over 31 years, and I've worked in a variety of settings with different types of patients. Early off in my career, I started working in rehab with stroke patients. And then a few years into my career, I moved from California to Texas, where I worked in hospitals so that I could have a more flexible schedule while I was raising my two small children. Um, in 2009, I was asked by a physician to become lymphedema certified and start up a lymphedema program at a local breast cancer clinic, which I did, but only after I thought about it for a while because when I was in PT school in the late 1980s, we really didn't learn too much about lymphedema. We had maybe a 1 or 2 hour lecture on it, and we're told, there's nothing you can do. Put them in a garment, give them a pump. And that's really all I remembered about lymphedema until it was brought up to me to become certified. Uh, when I started thinking about it, I recalled back to my childhood when my aunt, who was a breast cancer patient and had undergone chemo and radiation, would always complain about her swollen right arm and having to wear a sleeve. I was maybe 10 or 11 at the time, and I really had not thought about it until I decided I was going to become certified. After that, I decided I needed to do that for my aunt in her memory, as well as for all other patients who are undergoing cancer treatment. Um, I became certified in with close training in 2011, and I've since started up 3 different lymphedema programs here in San Antonio. I have been privileged to meet with and work with many wonderful people. So today, I hope that I can give you some basic information about lymphedema. If you have any questions, please free to type in any questions you may have, and I'll try to answer them at the end of the webinar. So here we go. I've got my PowerPoint. So today we're going to talk about lymphedema after cancer treatment specifically. There's many different types of lymphedema, which I might be touching on, but today I'm just going to talk about how it relates to those who have had cancer treatment. Now, not everybody who has cancer and who goes through the treatment, surgery, radiation, chemo for cancer will develop lymphedema, but many people can be at risk, and you should know what your risk is. Today, I'm going to cover shortly about the lymphatic system, what it is, and then explain things that you can do to lower your risk. And then, if it develops, how do we treat it? I hope that the people who can gain insight from this webinar are patients, their family members, and even their medical support team. So I'm going to go on to defining lymphedema, and it is spelled lymphedema. Lymphedema is a is an abnormal swelling of a body part. Uh, Edema is a medical term for swelling, and lymph is a lymphatic fluid. So when your swelling in your body has to do with your lymphatics, it's called lymphedema. It often occurs when the lymphatic system is damaged or it's blocked, but it can be controlled with the right treatment and care. It's not necessarily something that is completely curable, but we can manage it if it does give trouble in life. So I'm not going to go through a full anatomy and physiology lesson here, but I'm just going to give some basics on what the lymphatic system does. It's part of our immune system as well as part of our circulatory system, and it works very closely with our blood system, with our veins and our arteries. It helps to carry lymphatic fluid away from our body tissues. It helps to drain the extra fluids that we have in our body. It helps to drain the extra protein molecules that are in those fluids. It produces white blood cells. So here I have a picture of uh, a body here, and this is just an artist rendition. The green vessels on here are the lymphatics, and they're like a lacy network over the entire body, right under the surface of the skin. So here we talk about the lymphatic system. The lymphatic system includes the spleen, the thymus, the tonsils, bone marrow, lymph glands, and the lymph vessels. We have lymph nodes throughout our body. Most of us are familiar with the lymph nodes that are on either side of our neck. When you go to the doctor with a cold or the flu, you may recall the doctor palpating the side of your neck and saying, "Oh, that your lymph nodes are swollen. You're fighting a head cold." So that is an example of when we'll feel our lymph nodes and how our lymph nodes are helping to trap bacteria or viruses or toxins in our body and help to fight them. So the lymphatic system consists of those lymph nodes that I said are throughout the body. We've got them on the side of our neck, under our arms, in front of our elbows, in our groin, behind our knees, and hundreds deep in our abdomen. And then we have the lymph vessels that help connect them. Those lymph vessels collect the lymphatic fluid that is in your tissue, and that lymphatic fluid is composed of protein, water, fats, and waste products. It's not just water. Then the lymph vessels take the fluid to the lymph nodes, which act as filters for any waste products or foreign materials that the body finds in uh, the lymphatic fluid. And after it goes through several lymph nodes, then the lymph vessels return that filtered fluid back to the blood system. So eventually, what we do with any extra lymph fluid or fluids in our body, we all know we urinate all that extra fluid out. So here, the middle picture here shows how closely the lymphatic system is related to our circulatory blood system, with the heart there in the center, the arteries red, the veins blue, and the lymphatic vessels are green. The small cross-section of the skin that you see on the bottom right shows how closely the lymphatic vessels are under the surface of the skin. You see the cross-section of the skin, you see the hairs with the outer layer of their skin, and the blood vessels and the lymph vessels are right there at the right underneath the surface of the skin. So that's important when we start talking about the treatment. So there are two types of lymphedema. We categorize them and break them up into two different types. One is primary and one is secondary. So primary lymphedema, about 10% of people who have lymphedema in the world have primary lymphedema, and that's usually something that is caused by an abnormal development of the lymphatic system. Usually occurs genetically. It can present at birth or adolescence or even later in life. But that's another topic for another day. Secondary lymphedema is caused by damage to the lymphatic system. So that damage can be surgical damage, such as in cancer removal of the lymph nodes. Infection, there is parasites in in the tropics, in third world countries, where mosquitoes carry a disease called filariasis, and that can infect the lymph nodes and cause secondary lymphedema. Cancers cause lymphedema, radiation therapy for cancer. That also causes scar tissue to lymph vessels and lymph nodes, and then obesity. So all these different reasons can cause something called secondary lymphedema. There are 4 main stages of lymphedema. So first of all, I want to say it doesn't matter how large your arm or your leg is or how big the swelling is. The stage of lymphedema is not characterized by the size, but rather than the consistency of the tissue. So stage 0, or the latent or subclinical stage, is when there are treatments that may put someone, have been done that have put someone at risk, but there are no outward signs of swelling, no discomfort. So this may be someone who has had lymph nodes removed, has had chemotherapy and radiation therapy, but they are not having any symptoms. Their arms still may be the same size, they're not having any pain or achiness or heaviness of the limb, but they are still at risk. Stage 1 is called the pitting or the reversible stage. So this is when you start feeling that the limb is swollen, it's feeling heavy. Pitting is when you press on the skin and it leaves an indentation from that thumbprint or fingerprint, and that's called pitting. But it's reversible because if you elevate the limb for a period of time, the gravity will help to drain the fluid and the swelling may reverse. Stage 2 is called the spontaneously irreversible stage. So at this point, the lymphatic fluid has been staying in the interstitial tissues or the tissues under the surface of the skin and has not been moved. It's just kind of hanging out there. The limb is swollen. It may feel spongy. It may not pit. At that point, the fluid has stayed in there for so long that tissue fibrosis may develop and the limb may almost feel firm or hard to the touch. Stage 3 is elephantiasis. So that is a very advanced stage. The limb may become very large. Lobules may develop. Different types of skin conditions may develop at this point. This rarely happens in arms or in breast cancer patients, but it can be seen in the lower extremities or the legs. So, lymphedema and cancer. So, it's important to know that although most people who develop lymphedema after cancer treatments usually develop within the first year or two, often in the first few months, it could happen many years after treatment. So I give an example of a patient that I treated many years ago. She was 20 years post radical mastectomy of her breast, lymph nodes removed, radiation, chemo, everything, but hadn't had any problems for 20 years. And then for some reason out of the blue, it just started up and her arm became swollen. So when I talk later about the different risks and the precautions to take, if you are at higher risk, it is prudent to keep it in mind that anything could trigger the swelling to start. So that's just something to remember, that you're not completely out of the woods even a year or two after your cancer treatment. So not all cancers tend to develop or start lymphedema. The ones that I see mainly here at Liberty, I would say like 80 to 90% of my patients are breast cancer related lymphedema. But we've also seen patients who have head and neck cancers, cancer of the throat, the tongue, anywhere in the mouth, anywhere on the face and the neck. They can develop swelling from the collarbone up. Um, the arms, the chest, the trunk, body, uh, that's usually affected by breast cancers or melanoma, skin cancers, if the skin cancer is on that portion of the body. The legs, the types of cancers can be prostate cancer, cervical cancer, uterine, lymphoma, pancreatic, ovarian, and then again, melanoma or skin cancer. And that is because the lower part of the body is affected, radiation and lymph nodes affected would be in the lower half of the body. So I'm going to go over here how the lymphatic system fails to work properly after you've had cancer surgery. So I'm going to go first to my analogy, and then I'll explain how it works with the body. So let's talk about loop 410 or loop 1604. We've got 4 lanes going, traffic is moving well, but then suddenly there's an accident and EMS and the police have to block off 3 lanes, and we've got all that traffic trying to funnel into 1 lane. So the same thing with the lymph system. If you think about the lymph fluid are all the vehicles, and the lanes are the lymph vessels and the lymph nodes. If the nodes are removed or damaged during radiation, vessels damaged during radiation, the lymph fluid can't get out of that region. And so the fluid backs up and stays in the tissues. So that's how the area of the arm or the leg can be swollen and heavy with the extra fluid. So how do you know if you are starting to develop any lymphedema? People usually complain that their arm or their leg starts to feel heavy or ache or pain. And this is different than um, a tendon or a ligament or a muscle injury. It's usually more of a diffuse type of aching in the limb. Your skin may feel or look tight. Um, your limb may become more tired than usual with regular activities. You may notice that jewelry doesn't fit as well, clothing doesn't fit as well, it may feel too tight to put on. You might actually see swelling, and you may even get infections of the skin. So for the arms, what I tell people to look at is first look at your hands. We normally have a lot of wrinkles, some more than others, depending on how many years we've lived, but we've got lots of wrinkles on our hand. If the hand becomes swollen, you're not going to see the prominence of those wrinkles as much. Your hand may look younger. You may also not see the tendons of your fingers or the blood vessels in your hand as readily. I'm going to stand up here a little bit and show elbows so you can look in the mirror and see, are my elbow points here of my bone, my ulnar bone, are they as prominent equally? On your feet, you can do the same type of thing. Look at the wrinkles where your toes are. Um, Look at the tendons on the top of your feet and the blood vessels on the top of your feet. Do they look the same? Are they still as prominent as they used to be? And then your ankle bones on the side, you can also see, are they as prominent or is there some swelling? So there's different things that you can look at to see if you think you might be getting some swelling. So lymphedema is usually diagnosed by clinical exam. There are invasive tests, some different lymphography tests that can be done uh, to diagnose it, but usually it's done by a clinical exam. Uh, so the first thing there in the top left corner is called the Stemmer sign. So that was named by Dr. Stemmer, and it's showing how you can pinch the top of a digit, toe or finger, and you can see the normal one there. They're just pinching a little bit of skin. You can almost lift it up a little bit like a tent. Uh, but on the right side, it's that toe is so swollen that you really can't lift or pinch that skin. It's thick there. The next thing is, like I mentioned before, the pitting edema. So you can see on the bottom foot there, the pitting. Someone's pressed a thumb into the tissue and released the thumb, but the indentation still remained. And then the bottom are girth measurements. So what I do here in the clinic is either every 5 or 10 centimeters, I will mark a limb all the way up, both sides, and then take circumferential measurements with a tape measure to see how they compare. So if you go to a doctor and you're complaining about swelling, they may do the pitting test and examine your limb. And sometimes they may need to send you for special tests to rule out an infection or a blood clot before they send you for therapy. So next I'm going to go over quite a few slides that talk about risks and precautions. I want to have you take all of this kind of with a grain of salt. You know, every situation, every person is different. So all these risks and precautions can vary per person. I suggest that you talk to your lymphedema therapist if any of these risks are pertinent to you. But these are the general risks and precautions. If you are someone at risk, this is what you want to watch out for. So avoid temperature extremes. Uh, Anything hot or cold can cause the lymph system to make more fluid. More fluid means more fluid potentially getting trapped in the body parts that are affected. So that's talking about saunas, really hot tubs, showers, hot baths, including burns, skin burns, either from the sun or from cooking, and then also traveling in very hot or cold climates. Here in San Antonio, I would say I'm probably busiest during the summer months because everyone's lymphedema kind of gets exacerbated with our very hot, humid summers. So the next risk or precaution here is avoiding injury to the skin in order to reduce infection risk. So our skin normally has a very protective acidic layer on the surface of the skin. It also can have bacteria on the surface of the skin, and that's just normal. We're living in a non-sterile world. But if you are at risk of lymphedema or you have lymphatic fluid under the surface of your skin, you by having a puncture in the skin by a cut or an insect bite, um, that is a potential way of the bacteria to be driven into the skin and thereby causing an infection. So again, these are just general rules of thumb to be cautious. Um, so insect bites, manicures and pedicures, if they accidentally clip your skin. Um, you may want to wear gloves when you're gardening or doing any type of work around the home with tools that could potentially cut your skin. Doing vaccinations, acupuncture, any blood draws in the affected limb, I would be cautious about then. Of course, you know, if it's recommended by your physician or your medical team, you know, sometimes you have to weigh the risks and the benefits. So again, that's a case-by-case basis. Pet scratches, any cuts in skin, and then while shaving, be careful with the razor or any skin irritation. Next slide. So avoiding limb constriction. So if you are at risk for lymphedema in an arm, you want to be careful with lifting heavy objects or carrying a heavy purse across your shoulder, because that heaviness can cut in and block the lymphatic flow. Remember, the lymph vessels are right under the surface of the skin. So anything heavy or putting constriction on could basically be like stepping on a garden hose and blocking that lymph flow. So avoiding blood pressure taken on the affected or the at-risk limb. Tight clothing like bra straps, again, just like the heavy purse across the top of the shoulder. Heavy breast prosthetics in the bra that can also put more weight on the bra strap. Tight rings, watches, bracelets. If you're at risk for lymphedema in your legs, don't cross your legs while you're sitting because you'll cut off that circulation and that lymphatic flow. And do not wear tight socks or stockings that have tight bands. Many times I see people with lymphedema in their legs that come in with the real short ankle socks that are really, really tight. And so they're even causing more problems with their swelling because those bands are not smoothly distributed over the skin, but more concentrated in one area. Avoiding muscle strain. So exercise is good for lymphedema, but you don't want to go out there and be a weekend warrior and suddenly start lifting heavy weights or doing heavy gardening or moving if you're not used to it. So if you are used to exercise and weightlifting, that's great, but it's always important to gradually build up any exercise program. Avoiding vigorous repetitive motions. If you feel like your limb is starting to feel heavy or achy or tired, take frequent rests. Look at your arm or your leg before and after each activity to see if there's any changes. Some sports that are repetitive and forceful can potentially exacerbate or start a problem in a limb. Tennis, racquetball, golf are all sports where we're really swinging our arm and sudden force and weight put into it that could potentially cause more swelling. And I always tell people, wear a well-fitting, properly, professionally fitted compression garment if you are at risk and you're doing any strenuous activity. And I'll talk more about that in a little bit. So general guidelines. People ask me all the time, what type of foods should I eat for lymphedema? Basic nutrition is good. In fact, I have a book. Let me get that here. This really has everything in a nutshell on lymphedema and nutrition. It's a very good book. I'm not trying to promote it or anything, but if you need some more information on that. So lots of fresh food, whole foods, less salt, less fried foods, alcohol, nicotine, not good in general. Maintaining an optimal weight, because obesity is known to be a major risk factor for developing lymphedema. Sleep with your limb elevated or wrapped if you're being seen by a lymphedema therapist. Exercise is excellent, like I said, walking, swimming, and special exercises given to you by your therapist. Use hypoallergenic soaps and fragrances. Seek treatment early and promptly if you've noticed the slightest bit of heaviness or achiness in your limb. Treat infections immediately, and travel with your limb elevated and with compression on. So that takes us to our next slide. So if you're at risk for lymphedema, it has been recommended by the National Lymphology Network that you wear some type of compression, whether it's bandages or a compression garment, if you're traveling by air. I would see if you're not sure, ask your lymphedema therapist. It's a decision that needs to be made on each person's circumstances, where they're traveling to, how long, and what your stage is of lymphedema. So I'm going to move on next to the treatment for lymphedema. The gold standard in the world really is for treatment of lymphedema is called complete decongestive therapy. It's comprised of 4 components: a manual lymph drainage. This is a very gentle type of massage that helps to reroute the lymphatic fluid out of the congested part of the body, followed by compression therapy. And that is the application of an external garment or a device to help mobilize lymph fluid out of the tissues and back into the bloodstream. It may include multi-layer compression bandages, compression garments, or a compression pump. Then there's exercises, and I'll go over that a little bit more later. That is where we utilize the pumping mechanism that we naturally have in our muscles to help promote the lymphatic circulation. And then lastly, skin and nail care. You're taking very good care, meticulous skin care, good hygiene will help decrease your risk of infection and prevent any exacerbation of swelling. So we're going to go over the first part of complete decongestive therapy, the manual lymph drainage, otherwise known as MLD. Many people call it massage. It's really a manual technique. It's not the type of massage where you're going to go to a massage therapist and have them work out the kinks in your shoulders or your sore muscles. It's more of a gentle stretching of the skin to help to reroute the fluid in the affected arm to healthier lymph vessels. So it's very gentle, and it's just a stretching of the skin in an upward motion in a specific pattern depending on your condition. I've got the butterfly there on the screen. So the butterfly is the symbol of lymphedema, and it's based on this manual lymph drainage technique, which is known as being gentle as a butterfly's kiss. So if you see any butterflies in your lymphedema therapist's office, not only do we like butterflies, it's also because it's our symbol. So here I'm going to go on to compression bandages. So that's yours truly. Many years ago when I was going through my lymphedema training, and we would practice on each other and bandage each other. So this is an example of a leg bandage. So I want to show you the types of supply that we use for bandaging. It looks very much like an ACE bandage, which we all may be familiar from um, sprained ankles and such from athletic injuries. But these bandages are specially made for lymphedema. See if you can see it. So it looks very much like an ACE wrap, except it doesn't behave like an ACE wrap. It's called a short stretch bandage, and it doesn't stretch much. An ACE wrap would keep stretching. So what we do is we have multi-layers of this bandage around the limb, all the way from the fingertips up to the armpit, or from the toes up to the knee or to the groin, with foam underneath to help compress the tissues and push the fluid back up into the circulation. So how it works, and I think I have a slide on this in a little bit, is the lymphatic tissue, vessels are right under the surface of the skin. So we've got the muscle layer, then the lymphatics, and then the top of the skin. So when you put the bandage on top of the skin, wrapping it, and you've got the muscle on this side contracting and pumping, and you've got the bandages here, multi-layers, more at the bottom, less at the top of the limb, the muscle action and the short stretch bandage not letting the fluid go anywhere, it's only going to encourage it to go to the path of least resistance and move up. So that is the idea with the compression bandages. And I've got a few more pictures of that. So as you see here, the bandages here is showing what an example of what an arm or leg bandage would look like. The leg very similar to my previous slide, the picture of me, and the hand here with finger wraps on, and then moving up the arm with the short stretch bandages. Here's a picture of an arm and a leg with lymphedema and kind of the difference that you see between the limbs. So there are many different types of compression garments, different brands. So I've listed all the different brands there. And for the upper extremity, we've got the arm sleeve and a glove. So I've got some examples here to show. So this is let's see, let me get it in front of the camera here. So this is an arm sleeve. It ends here at the wrist, goes up to the armpit, and has some silicone dots here to help hold it up. And they come in different strengths, so it's quite firm. And then it would be similar for the glove. The next slide, I have some examples of lower extremity garments. So the first photo is a knee-high, and I have a knee-high example here. It has an open toe, so that it's easier to take on and put on and take off the heel. And at the top, going up to your knee, it has those same silicone dots to help hold it on. And the middle picture is a thigh-high stocking, and then on the far right, we have what we call an inelastic garment. It is Velcro straps. They're not stretchy, but they do help to contain the limb with the amount of tension that you place on each strap. So it's really up to you and your therapist to determine what is needed, what type of garment. There's many more details on garments to look at and features to look at depending on your individual situation. So the lymphatic exercise. So I just kind of went over how the muscle pumping action is emphasized when the arm or the leg is bandaged. How here we've got the red is the muscle there in the picture, and the lymph vessel is the blue one in between the two muscles. So as the muscle is contracting, it's squeezing the lymph fluid through the lymph vessel, through the valves there, and up back into the circulation. So there are certain pump exercises that I give to patients to help stimulate the lymphatic vessels with compression on, either compression bandages or compression garments. So with any type of exercise, it's always important to slowly increase the intensity or the weight of the exercise so that the muscles of the limb do not become overly tired. So the more exercises here. This is just a picture of someone exercising with bandages on. She's got her left arm bandaged, and she's just doing a simple bicep curl with a wand and a weight on it, helping to engage her biceps or her upper arm muscle pump, and in her forearm to help move that fluid along. People are always asking me, well, what is the best type of exercise for lymphedema? My number one recommendation would be anything in the water, in a pool, swimming or water aerobics, because the pressure of the water, the further down you go in the water even, it provides its own pressure or compression on the body, helping to increase the lymphatic flow. Other types of recommended exercises would be yoga, Pilates, Tai Chi, anything low impact, aerobics, bicycling, walking, strength training, or using the stretch bands for strengthening. As I mentioned earlier, anything that is with repetitive motions or forceful motions are not recommended. But again, if it's something that you are used to doing and you have done in the past, you have to take all these recommendations kind of with a grain of salt, because it's different depending on each person's situation. But any exercises are okay as long as you're wearing compression, some type of compression on if you're at risk or if you have lymphedema, and if you make sure that you are uh, examining your limb before, during, and after, and take note of how you're feeling. If you have had recent surgery, cancer surgery, you do need to wait till your doctor gives you prescribed exercises for specifically for range of motion and stretching. That's something, again, that needs to be taken on a case-by-case basis, but I would refrain from starting anything until you check with your physician if you are a recent surgical patient. So going on to the fourth component of complete decongestive therapy is skin care. So very important to keep your skin healthy. I mentioned precautions earlier, like wearing sunscreen to prevent burns, wearing gloves to prevent cuts, being cautious when you go outside where there may be insects. But here I'm going to show you some examples of gentle, unscented cleansers and lotions that are best to use with those with lymphedema. Those that have a neutral or a low acidic pH. They do not have any fragrances, and they're hypoallergenic. So I've listed some. Eucerin, Aquaphor, are great. Unscented Dove soap, Cetaphil, Cheryl, all of those brands are great for under compression bandages, as well as a daily moisturizer or soap. So besides the cosmetic complications of lymphedema, or the heaviness or achiness, there are other things to be cautious of and be aware of. So I mentioned earlier that lymphatic fluid is comprised of protein molecules. Protein molecules in the lymphatic fluid, if the lymphatic fluid is not moved out of the limb and that protein becomes stagnant in there, It's a perfect breeding ground for bacteria. So if you get a scratch or a cut or an insect bite and you introduce any bacteria into the lymphatic limb, you could potentially get a life-threatening infection called cellulitis. Um, so I tell patients, keep an eye out if you've got a fever, if you start to not feel well, if your limb becomes red, warm, pain, swelling gets worse. Uh, it's not something to wait on or to fool around with. I would go ahead and call your doctor, go to urgent care, um, and make sure you don't need some type of antibiotics. So it's very common with patients who have more advanced stages of lymphedema to get infections or cellulitis. Um, Another complication of lymphedema is a hardening of the body tissue. So this happens in the later stages um, when lymphedema is not treated early. Uh, it, the fluid stays in the tissues and become harder. Once those tissues harden, they change at a microcellular level, and it's very hard, very difficult to soften them back up again. So it's important to get treatment early. Um, Most people tell me that lymphedema doesn't really cause very bad pain, but it's uncomfortable because of the stretching of the tissues, stretching of the skin, and the swelling. But that is something else. So here I'm just listing some resources for you to look online. There is something that's been going on for a while called the Lymphedema Treatment Act, where Congress is, we're trying to get Congress to pass this act to make insurance companies provide coverage for lymphedema compression supplies. Um, Most of the bandaging and compression supplies and garments are not covered by insurance, not covered by Medicare. And we are hoping with the Lymphedema Treatment Act that we can get insurance to start paying for it. So you can go on this website, www.lymphedematreatmentact.org, to see more information. So here at Liberty Rehab, I'm at the Northeast location here on Tuesdays and Thursdays by appointment. And referrals to see me can be made by your primary care doctor, your oncologist, your surgeon or your plastic surgeon, or your radiation oncologist. Uh, Once you get the prescription and it's sent to our office, the scheduler will call you to make an appointment. Uh, when I first see you, I'll see you for an initial evaluation. That's when we do the exam and take all the different measurements and talk more about your individualized treatment plan. Um, Most of the treatments are scheduled twice a week, 4 to 6 weeks, and you are with me for one-on-one for an hour. And lastly here, I have some online resources. Uh, the National Lymphedema Network has quite a bit of patient resources and educational materials, the American Cancer Society, and there's some specific lymphedema-only websites such as Step Up, Speak Out, and Lymph Notes. So that is the end of my presentation. I thank everybody for joining me. I'm going to see, are there any questions? I don't see, I don't see any questions popping up right now. I am understanding that this will be recorded and available for viewing later. And if you do have any questions, the phone number here at Liberty is 210-656-5848. You can always leave a message for me, um, and or leave comments on our Facebook page, and I will try to get back to you. I thank you very much for joining me and taking time out of your afternoon to listen in. And I can help you in the future. I hope that you will be able to reach out to me or inform your doctor a little bit more about lymphedema. Thank you very much.